I now recognize Mr. Marshall for 5 minutes.
Yeah, thank you, Chairwoman. I think first I just want to compliment all my fellow minority members for making it to these hearings, and it looks like that once again the dais is kind of tilted over here towards our right, so appreciate the participation. My first question, Dr. Copon, would be to do with the cybersecurity framework, which has been a success. In September 2018, NIST announced the launch of its privacy framework effort. It's intended to complement the cybersecurity framework to help organizations manage privacy risk. Maybe got 2 or 3 questions. You can bundle them together here. How's the development of the privacy framework progressing? What's NIST heard from government, industry, academia regarding the usefulness or necessity of guidance like the privacy framework? Is it something government and industry have asked for, or suggestions that might be helpful in managing their privacy risk?
Thank you so much, Congressman. This is a key area of NIST's focus currently. NIST launched its work in the development of the privacy framework actually at the encouragement of the private sector, who was being challenged with a patchwork of regulations that they were seeing to manage across these United States as well as globally. And the success that we've had in the cybersecurity framework was seen as an excellent model. It's one where the private sector, government, public sector entities could collaborate and look to the aspirations of the future to have a framework that truly represents best practices and not a regulatory approach, a checkbox kind of mindset. Industry has appreciated so much the approach of having a framework that looks always to managing the risk environment, the threat environment. And so after the launch of the privacy framework activities, in which I've been personally involved and delighted to support, NIST has had several public engagement opportunities to bring feedback together. On February the 27th, we issued a framework outline and initial summary of feedback received from public, private sector stakeholders. We're planning our follow-on workshop in Atlanta, Georgia, May the 13th and 14th. We had originally planned that during February, but a certain thing called a government funding lapse kind of got in the way. But we are pleased that we're back on track. We're looking to make a lot of progress this year, and we're anticipating a working draft of this framework for public feedback within the next several months.
Well, great. Let's talk about microelectronics for a second. As a physician, I've always been curious about the microelectronics, and it's been actually, I think, 20 years ago that they introduced these little cameras that they could drop into someone's mouth, and it would go through the stomach and the small intestines, and of course through the colon as well. Anybody that's had a pleasure of an EGD or a colonoscopy, this was a great promise. But yet it's still not really taken hold. It's still not the gold standard. We're still doing, of course, colonoscopies and EGDs. So you've got $10 million for the microelectronics. Maybe to share a little bit more about it and its importance to United States security and economic competitiveness, and access to trusted and assured microelectronics.
Thank you so much for that question in follow-up, Congressman. Microelectronics has been a core of U.S. industrial leadership, and I'm pleased to indicate that NIST has been involved from the very beginning of the NIST electronic industry initiatives to enable industry to measure, to create the kind of standards that are necessary to have the advances in medicine, in communications, in computational technologies, and so on. Our budget proposal would really increase our ongoing efforts in the development of measurements. New materials are absolutely critical to achieve the kind of device miniaturization and high degrees of performance, and also to be able to have the kind of connectivity that's necessary to the ability to do remote medicine, for example, and to have patients in other parts of the nation who can take advantage of 5G communications technologies that connect with microelectronic systems and enable intelligent, personalized medical procedures to be carried out. It's so important to have a rigorous standardization process as well, and NIST works closely with industry to ensure that in all aspects from the manufacturing process to the standards of commerce and how these systems will be used. And now we're working on standardization for all radiological devices and for magnetic resonance imaging, because there's been so much repeated testing that's been done because of that lack of standardization. We look forward to that work continuing under this increased funding. Thank you.
Thank you so much. I yield back.